All right. So today we're talking an employer's guide to healthcare price transparency. And you may ask, do we really need an entire session examining federal transparency requirements? And the answer is yes, we do. It's important to revisit these types of topics from time to time to see what has changed. As Katie discussed in her session this morning, this is a huge piece of ongoing litigation, federal agencies continuing to come out with more guidance, agency guidance being deferred from time to time. So there's some key developments that we're going to cover today. And given that it's a shorter session, I think it'll be more palatable. And I cannot even believe that we have so many individuals in the room right now. So kudos to you for caring about transparency because we really have to. So with that, we'll get started. Today, I want to talk a little bit about context and background, reminding us where did these transparency reporting obligations come from? What's driving them? Are they meaningful? Some are more helpful than others. And what is ultimately being done with this information now that we have a few years of reporting under our belts, which we'll discuss, and I'm sure you have commentary as well, was a struggle to get to this point. We'll talk about some state-based initiatives. I think a theme in general in the healthcare pricing industry is that absent any meaningful federal action at the federal level, states have begun to take matters into their own hands, passing their own types of state initiatives to get something across the finish line. It's also become a bipartisan political priority that I would also say that you see state senators and representatives introducing bills saying, hey, I'm going to crack down on healthcare costs, and here's how I'm going to do it with meaningful transparency requirements. And do they really know what they're talking about there, and what is the actual result of those reporting requirements? Then we'll talk about our classic examples of federal transparency reporting obligations. We have the Transparency and Coverage Final Rules, and then also the Consolidated Appropriations Act of 2021, which was RxDC reporting requirements, as most of us in this room will know. And also, I broke it out separately, but part of the Consolidated Appropriations Act of 2021 was the No Surprises Act, which has consumer protections against surprise billing. We'll discuss that as well because more litigation is ongoing in that space as well. I wanted to compile this list to remind everyone these are all topics that are transparency related and in some cases have required reporting obligations that 4 years ago wasn't even on our radar. So now not only do plan sponsors and yourselves have to be involved in the day-to-day operations of your benefits plan and trying to deliver sustainable benefits and keep your employees happy, there's also lots of requirements that you need to make sure that you're meeting from a federal transparency initiatives. And as we all know, some of this information isn't in your hands to begin with. So there's a lot of facilitation of vendor reporting that is also necessary as a result of these laws, but the burden ultimately remains on the plan sponsor to file that reporting. We'll talk about, just want to make a very brief comment here about this rebate justification point that I put on this slide. We talked a little bit this morning about the Florida pharmacy benefit legislation that was passed last year. And one piece of the Florida legislation that a lot of people have not picked up on, and I think it's kind of flown under the radar, is that there's a piece in that bill that says that plan sponsors have to have transparent pricing and rebates must be passed through to the plan sponsors for the sole purpose of reducing premiums and offsetting cost sharing. So that's an interesting piece that I think you should earmark, and we will see that probably more going forward with state legislation, but that begs a lot of questions. How does one track that? Is that really the authority of the state to be getting into that piece anyway? And then there's plenty of ERISA concerns there as well, as far as are states allowed to say what to do, what you will do with plan assets as well, and can they direct that? So haven't heard a lot on that piece, but I think you'll see that as a theme. Rebate justifications. What are you doing with these rebates? That's also a piece of the RxDC reporting as well, and we'll discuss that later. And then just all the other items you'll see in the reporting rules that we'll cover, cost comparison tools, prohibitions on gag clauses, your machine-readable file requirements. As if that's not a nightmare whenever you hear the words machine-readable file, we'll talk about those as well. So what's driving these initiatives? I think we've heard a lot over the last few days about innovative therapies and drugs that are coming out. It's driving up costs. So what are the congressional initiatives that are examining these prices and trying to determine what can we do to make things more transparent and ultimately drive costs down? Katie covered this morning, there is the Lower Costs, More Transparency Act that passed the House at the end of last year. And some of those transparency provisions could ultimately make it into some type of budget reconciliation in lame duck session, as she said, or really any time the government passes some ongoing funding. And so there's that piece. We also have political pressure. We have changing presidential administrations. When the Trump administration was in power, they also came out with executive orders saying this is a major priority. We're going to crack down on prescription drug prices. We're going to promote transparency in the healthcare pricing market. That was also an initiative of the Biden administration. And what you'll see in some of the clunkiness of some of these transparency laws is that it was a law that was passed by the Trump administration, and then you had the Biden administration that then had to write the implementing rules to ultimately put those provisions into effect. So that has to do with some of the duplicative nature that we'll see and we'll talk about in transparency and coverage in RxDC. And then also there's a consumer protection piece to this. Definitely in the cost comparison tools, empowering consumers to be prudent purchasers of healthcare, being able to see the exact or an estimate of the cost sharing liability for certain different services and providers. And then also the No Surprises Act, which was very consumer driven to protect consumers from surprise medical billing. Really quickly, I mentioned how absent any federal action, which there has been quite a bit of federal action in the transparency scheme. I think it's become quite a bit of a buzzword because you still see states continuing to introduce and consider transparency regulations at the state level. And what's incredibly frustrating as someone who tracks this on a daily basis is when you see a state introduce a transparency law that is duplicative of what is already federally mandated. So this is already something that has to be reported at the federal level. Why are we then also having state-specific reporting? And what are states doing with this? Do they have task force that are meaningfully examining this information? What's ultimately being done with this info? I think there needs to be more information on. So that's just for 2024, what we see states currently considering. A lot of these transparency bills don't gain a lot of steam. Sometimes it's just a political win to say, hey, introduced a meaningful transparency bill, and doesn't gain as much steam as we see some of the other pharmacy benefit legislation. Then also, we have enacted PBM contracting pricing laws. During the consultant panel yesterday, they talked about spread pricing bans and states that are mandating a pass-through pricing model. Talked about the differences between those two and whether or not a transparent deal is necessarily the best deal, because what you're doing is just the PBM. The plan is paying exactly what the PBM is reimbursing the pharmacy, plus an administrative fee. And whenever you take away the ability for the PBM to take on any risk in a lesser payment or an overpayment to the pharmacy, you're taking away the opportunity for a PBM to make spread, but you're also taking away the opportunity for you to pay less than what was actually reimbursed at the pharmacy level. And something that I just like to point out, while these are state considerations and federal considerations, employers always have a choice. You always have a choice between a traditional spread pricing contract and a pass-through pricing arrangement. That's always something that is available on the table for you. We can model that, show you the pricing there. And you have the states up there in dark blue. Those are prohibitions on spread pricing. And then the ones that you see in light blue make states, they're all a little bit different, but every year you'll just have to make an offer of pass-through pricing, or just confirm every year, hey, you currently right now have spread pricing, here's a transparent pricing offer, just confirm in writing, do you want to keep this? So I think that's good. I think anytime that we can preserve employer choice in the matter, especially because of all the unique considerations that go into choosing what type of arrangement you were contracted under, that's the best practice. And we really don't want to get involved in dictating what type of a contract plan sponsors are arranged under. So that's what's going on at a state level, but the main points that I want to hit home today are our existing federal transparency requirements. So going back to 2019, the transparency and coverage rule, this was a two-part rule. I think the easier to understand piece was the member cost comparison tool. And so this means that now all of your plan participants should be able to access a tool that's usually housed on your medical carrier's website, and they can go in and they can get a cost estimate for any type of covered item and service, get an estimate of what their cost sharing liability is going to be. This is something that was always around before. I just think that this law made it a requirement, and it made vendors have to do it in a way that was accurate, timely, and they had to add all of the services that are covered under their plan. So this has been a requirement for a couple of years now. I think that this has gone extremely well, and every year those cost comparison tools, because it's a federal requirement now, are just getting better. The more difficult piece of this puzzle was this ongoing monthly obligation to post machine-readable files to a public website. So this is on every plan sponsor's website. Sometimes it's a link to the medical carrier that will post the machine-readable files, but it's publicly available. And there are two pieces that are medical files that are posted. That's your in and out of network rate files and allowed amounts. And then there was a third piece that was a prescription drug historical net pricing file. And that piece, the historical net pricing file, was delayed because there were many lawsuits on that. And Katie talked a little bit about that this morning, but PCMA sued saying, hey, we can't disclose historical net prices because they were concerned about publishing prices that were net of rebates, discounts, and other price concessions, because they were fearful that manufacturers then would have insight as to what their competitors were negotiating. And if they were negotiating far below or accepting an offer that was far below, that would hamper competition and ultimately not contribute to lowering cost prices overall. But October of last year, the government has pressed play on the machine-readable file for the prescription drug benefits. So that will be a requirement. I hate saying this, and I always say it. Additional guidance is forthcoming from the departments on this piece. But this will now be a requirement that you will continuously have to post, or your vendor will post for you. And certainly, in that piece, the PBM will have the information and have to report this for you. But something that I just wanted to cover, if you go and try to access these machine-readable files, this is not a consumer-friendly tool. This is a public disclosure, and I picture it's someone in the basement with a giant computer that is looking and analyzing all of these files and trying to make sense of it. This is not. No one in this room, maybe someone in this room, can look at this and make some sense of it. So I was looking at 10 employers that are actually here, trying to find machine-readable files on their website. Easy to find. You're all doing a great job. Normal computers can't access these files. My computer was so messed up afterward trying to click onto these links, and I thought I would include some of the language that is on these websites. So it says, the information contained in this machine-readable file may be difficult to access without certain technology, may take hours, days, or weeks, depending on file size and hard drive combination. These are right in bold on the website. So I think it just goes to show that meaningful transparency, there's stuff that's easy for the consumer to understand, and then there are pieces where it's like, what are we going to do with this? And you don't know. Is there a task force out there that's examining this material? Has the government directed any group to meaningfully analyze this data? We don't know, but for now, we are stuck with majorly large files that most of us don't even own a computer that is large enough to open the file. Consolidated Appropriations Act, we'll just run through. There were three main pieces to this major piece of legislation. It was a bill that was over 2,000 pages long, gag clause attestations. So part of the Consolidated Appropriations Act was that it mandated plan sponsors to report prescription drug information. That's called RxDC reporting, separate from transparency and coverage rules. What the law also did was it said, hey, plans have to report this information, but wait, plans don't have this information. The plan service providers do. So it said, plans, you are not allowed to enter a contract with a plan service provider that limits or restricts access to any of this information. So in a way, it was an indirect ban on gag clauses, but it is enforced through group health plan sponsors because they are not allowed to contract with a provider that won't provide this information to you. And what's more, to make it a little bit more confusing, that's against federal law. You also every year have to attest. I continuously will not contract with any health plan or any plan service providers that include gag clauses in our contract language. So that's something that now every year before December 31st, you'll have to fill out. And this isn't something a vendor can do on your behalf, but they will provide statements of attestation to help you fill out that information. So for Employers Health, our contract, we've provided language verbatim that confirms compliance here, and our contracts never included gag clauses. This has been an out of date practice anyway, but certainly it facilitates the provision of the RxDC filing. And that was probably the biggest piece of the Consolidated Appropriations Act of 2021, which was required yearly prescription drug data that has to be reported by the plan. That's due every year by June 1st. Again, most of this information comes from your plan service providers, but it's interesting because there's still pieces that plans will have to report. So on the next slide, we'll highlight exactly what you're reporting and hopefully make you feel better that a lot of this information, while it is ultimately your responsibility to make sure that it is reported, it's not information that you have access to. And plan service providers are providing that on your behalf. So for your plan list, these are all 3 separate categories that you need to report. And I've highlighted in green what the PBM will report on your behalf. Certainly the PBM will need certain information from you, and I've heard that there's a deadline, maybe the 15th, that PBMs have asked for you to support or supply certain information to facilitate the filing of the P2 file, which is just a group health plan list. It's a list of all the plans that any entity could be reporting this information on your behalf. The data files section, D1 is completely the plan sponsor's responsibility, and it's because you're reporting on your average monthly and yearly premiums for your members. And then what life years means is just the average amount at any given part of the year, the average amount of life years, member years that you are covering on your plan. What I think is so interesting about the data file requirements is that the PBM certainly will report this on your behalf, but the data is not very granular. So service providers are going to report at the state and market level. That's how it's aggregated. Man, I'm running out of time. So plan sponsors, even if you operate across 40 different states, you're going to file in the state that you have your principal place of business, and it is going to be all of the information for any employer that is in that state and at the same market level. So most employers in this room will be reporting at the market level of self-funded large employer. So this data is massively aggregated. So it kind of seems silly when you think about it that individual plan sponsors are even responsible for any of it to begin with. But certainly there's lots of pieces. There's a narrative response piece where plan sponsors can describe anything that basically that they didn't understand in the instructions, because this is a work in progress. The instruction manual is 80 pages, and at the bottom of every page it says, come to a reasonable determination about how you should report this information. It's still every year being updated, and we're going to get to a point where this is much easier to understand. But for the time being, that narrative response file is your safe harbor where you can explain away any confusions or discrepancy, because this is really difficult information. So if you ever have any questions about RxDC reporting, happy to answer that. It's just incredibly nuanced questions that will come up with this. I'll end on this piece. People ask me all the time, why are employers on the hook? And the problem here is you have Congress passing a vague law that says, hey, plan sponsors need to report X. Then they realize, wait, plan sponsors don't even have this information. I mean, I'm a broken record. I've just keep saying that piece. So then the departments, the right, the implementing rules to implement these regulations, they don't have authority over third-party plan service providers. They have authority over group health plans. So ultimately, the burden and the onus is on the plan sponsor, but the information, again, is in the hands of third-party plan service providers. And then I just, because I like to, certain little comments like this haunt me in my sleep, but in a completely unrelated document, this is a document concerning mental health parity. Every year, the departments have to write a report to Congress about mental health parity for the year. But in this mental health parity report, the Department of Labor asked Congress to amend ERISA to include express provisions that would give the department's authority to directly pursue enforcement in violations against plan service providers. So this is something that needs done at certainly a higher level. And because we're stuck with the regs that we already have on the books, the departments can just do their best to implement them in a way that makes sense. And right now, the way that makes sense is holding the plan sponsors accountable for that and relying on that information coming from vendors who have been pretty great to work with from a providing the plan information standpoint. I think that they all have really robust reporting systems in place now, and it's certainly not something that wouldn't be provided anyway because according to federal law, they have to. And then Katie didn't get to her surprise billing protections slides either, but my slides are very wordy because I am an attorney and I want you to be able to look back and reference them to the extent that you need to. So a nice little synopsis of what's going on with surprise billing, and really what is going on is that it's still bound up in quite a bit of litigation, and there's thousands of claims and millions of dollars that certain emergency service organizations are waiting to get paid for the providers.